In the heart of Nandi County's Chemelil sugar belt, the quiet village of Potopoto stands as a testament to rural life, where agriculture thrives and community bonds remain strong. Against this backdrop, a crucial health intervention is unfolding. At the Potopoto dispensary, Nurse Patrick Kene oversees the arrival of treated mosquito nets delivered by the Kenya Medical Supplies Agency under the Global Fund program.
And we receive patients between 20 to 30 per day, and out of those 20 to 30, three-quarter are cases of malaria. Being an endemic region close to Nyanza, it serves people of Nandi and people from Kisumu County also. Here at the facility, that is Chemelil, we have received a total of 1,181 nets that we are expecting to issue them to the locals.
These nets are part of a nationwide initiative aimed at curbing the spread of malaria in high-risk counties. The mosquito net distribution is part of a larger effort by KEMSA to supply 10.9 million treated nets across 22 counties where malaria poses a significant threat. According to the World Health Organization, women, children, and the elderly are especially vulnerable due to their lower immunity. Malaria prevalence in Kenya varies widely based on factors such as altitude, rainfall, and temperature. Stable malaria is endemic in regions like the coast, Nyanza, and Western, while areas like Machakos, Embu, and Kitui experience unstable malaria. Highland areas such as Nairobi and Mount Kenya remain malaria-free due to their altitude. Nandi County has received 199,197 treated nets under the program.
The sub-counties that border the lower-lying counties, like the Nyanza counties, are always experiencing continuous transmission throughout the year. And their pattern basically mirrors that of the lake endemic counties like Kisumu, which is our neighbor here, Kakamega, Vihiga. So for the past, I think almost 2-3 years, the malaria program, National Malaria Program, has managed to reclassify and treat the 2 sub-counties that border the lake endemic zones to be endemic, meaning that we have malaria throughout the year. By reclassifying Nandi into the 2 epidemiological zones, that is the highland malaria part and the lower lying malaria endemic zones, that has enabled interventions to also be tailored towards in terms of prevention. So what messages are we telling the people that live around those 2 sub-counties? And what interventions is the government taking down to those other sub-counties? So the National Malaria Program has come in, and one of the main interventions is to continue supporting the issuance of long-lasting insecticides, bed nets for the 2 sub-counties.
To ensure proper distribution, KEMSA has implemented a robust tamper-proof system to prevent diversion and guarantee the nets reach intended recipients. In Aldai sub-county, malaria prevalence has been steadily declining.
Net distribution being one of the malaria intervention. So we have this for mass net distribution. We have for routine, that's for ANC and children under 1 year, being one of the intervention. So, it has been a very good intervention within this community. In fact, if after 1 year you'll see them complaining, are we going to get nets or whatever? So they have trusted in nets preventing malaria. So in fact, we thank the government for supporting us in terms of mass distribution of nets, because that one at least it covers the wide population than for ANC and because when you look at the ANC, it's only a pregnant mother and a child. But this one, at least, house coverage is the households are well protected.
Despite these efforts, malaria remains a significant health challenge in Kenya. According to the Kenya Malaria Indicator Survey, approximately 4 million Kenyans contract malaria annually, with over 10,000 fatalities. upsurges are common, especially after rainy seasons, highlighting the need for sustained efforts. With coordinated efforts from the government, community health teams and funding from partners like the Global Fund, there is hope that malaria's grip on communities like Potopoto will continue to loosen.